All right. Could you introduce yourself for the camera?
Sure. Dr. Don Reagan, physical therapist. I run a clinic here in Chatham, Virginia, Mountain River Physical Therapy.
So Don has been my physical therapist for the time that I've been here in Lynchburg, and we met each other a couple years ago at a.
I was just thinking about this 4 years ago.
God, it was 4 years
in
ago.
New York City in Manhattan. We were both taking a functional movement screen course with Lee Burton.
Could you, I guess, just let the students know where you started, what you went to undergraduate for, and how you ended up sort of step by step going to PT
Certainly,
school?
yeah. So I went to Liberty University. Got my bachelor's in exercise science with an emphasis in strength and conditioning. Spent a lot of time in the weight room there at Liberty with Bill Gillespie, Dave Williams. I competed in powerlifting and Olympic style weightlifting. So strength and conditioning and fitness industry was really, really interesting to me. I worked in multiple gyms, both in high school and undergraduate. Finished my undergrad degree, spent a year between undergrad and graduate, where I worked at Duke University Healthcare System and Duke Sports Medicine. Did a little bit with performance enhancement with the athletics there, did a lot of personal training. It was great, I had a great experience, really enjoyed the fitness industry, enjoyed strength and conditioning, but just felt a need to learn more, and I wanted to be able to provide more to my clients. Always felt like fitness and strength and conditioning would be a part of my practice. In fact, it's a big part of what I do here in Chatham. We're kind of a unique facility in that we have a barbell, we have kettlebells, we have sandbags and atlas stones, and just creative ways to load people, and we're not afraid to load folks. So let's see, after Duke I interned and worked there, and then went to PT school in San Diego. Got my DPT degree there.
What school did you go to out there?
University of St. Augustine for Health Sciences in San Diego. So it was a program heavy in orthopedics and manual therapy. Was really interested in learning how to use my hands to feel and assess, diagnose.
And that's a big scope of practice difference between strength and conditioning and physical therapy. Is hands allowed?
I mean, I think it's important to recognize that physical therapy is a very broad profession in and of itself. So there's lots of reasons for people to choose physical therapy. There's lots of different venues and aspects, and even within outpatient orthopedic physical therapy, there's a lot of diversity in how different people choose to practice physical therapy. I personally feel like going to PT school made me a better coach. Just had an athlete compete in Olympic weightlifting this past Saturday. Did a great job, got an opportunity to coach him as a weightlifter, but also had an opportunity to use my hands to both assess movement dysfunction, soft tissue dysfunction, and then treat him as his physical therapy provider. So for me, physical therapy school was about becoming a better coach, and continue to still work in performance enhancement. So I'm still really very interested in that. But I'll be quite honest with you, going to school in San Diego, the majority of my class were endurance athletes, and so I was the lone sheep, I guess.
Yeah.
The black sheep.
San Diego being the triathlon and marathon capital of the country. Sure. I'm sure.
So during like lab, practicals or lab exams or lab time, we'd have a break, and I'd be doing pistol squats in the corner, and everybody else would be, talking about their triathlon programming. So there's all kinds of reasons why someone would go to PT school. That's just my story. I really enjoy strength sports and working with strength athletes, CrossFitters, and runners, and so on. So after PT school, went to New York City, took my first job there, where I met Professor Sanguini. Ended up teaching for Equinox as a master instructor for their personal training curriculum, because that's been an important piece of my career. Is at every stage I've been in, I've wanted to continue to amalgamate fitness, strength and conditioning with medicine, rehabilitation. So that entire continuum, wanted to have a hand sort of in both realms and environments. So had the pleasure of teaching at Equinox, which was a great experience. Was there for a year. Came back to Lynchburg, Virginia, where I was teaching at Liberty University. I taught a strength and conditioning course. It was a preparatory course for the CSCS while practicing clinically in Lynchburg, and then had an opportunity to come down here to Chatham and apprentice with Gray Cook, teach for FMS, and run a practice. So that's where I've been now.
A lot of students probably have no idea who Gray Cook is or what the FMS is, so maybe you could give a...
Sure. Yeah, I'm sure that Professor Collins will certainly present it to you as well. But the functional movement screen and functional movement systems, it's an approach for both assessing movement, looking at movement primarily, and then a metric and diagnostic for what should you do once you find something that you think is needs to be addressed. So basically an approach where you're looking at movement first and then thinking about parts or exercises or performance afterwards. The movement screen is being used really across the world now, different sports, different levels. So Greg Cook's a physical therapist, Lee Burton, his business partner, they started functional movement systems about 10 years ago. And just really that approach really appealed to me, looking at patterns first, and then in a clinical setting, thinking about the parts. Is there a stiff joint or a hypertonic muscle or an irritated nerve root? And then if I'm more in a performance weight room environment, looking at performance measures. But I think proper assessment and intake of clients, both athletes and non-athletic, is about looking at patterns first. Because if there's a problem with the part, you're going to see it in the pattern. And if someone's got good patterns, and they probably have fruitful and fertile, that's what I was looking for, fertile grounds for performance. So if someone has a good body weight deep squat, then I think that means that you can safely load their deep squat in the weight room. Or you can ask someone if they have a good leg raise, and they should be ready to sprint at 100%. And so looking at patterns to me is the gateway or the connection between parts in medicine or performance in strength and conditioning.
So could you briefly list off your certifications that are both in physical therapy and in strength and conditioning, because a lot of the students are trying to decide where they need to go with that type of credentialing? Sure.
I think it's important that when you finish your bachelor's degree that you have some sort of certification or license, that you feel connected to a profession or a demographic. So for me, it was important to get my CSCS, Certified Strength and Conditioning Specialist, through the NSCA, the National Strength and Conditioning Association, which I have since served as the chair of the Sports Medicine Special Interest Group. So I've got my CSCS, which I think is one of the more challenging fitness designations to get because it requires a bachelor's degree. And then it was also my passion was strength sports and weight training. Went to DPT school, got my license as a physical therapist, and that's really it as far as on paper. I'm a credentialed clinical instructor for physical therapy. I've taken some courses in manual therapy and dry needling, but in general, I guess really I still consider myself to be a generalist. And although it's not on paper, apprenticing with Gray was the best choice I could have ever made for my professional development and how I look at problem solving with clients and practicing physical therapy. So finding a mentor, that was very important for me, and I needed to find someone that also respected strength and conditioning as much as I did, and that I was willing to submit myself to. And Gray was a great mentor for that, and he still is. So.
And you bring up a really great point there about being willing to submit yourself to a professional. And I've talked to the students a lot about identifying people who are good and reliable sources of information. Sure. And I know just from knowing you the time that I have that you have really put yourself in a position to learn from a lot of different people. I'd be interested if you could talk about maybe how you identify quality and and that type of thing.
Yeah, it's a great question because in our industry, fitness industry, medicine, there's just a lot of marketing, and that's how a lot of folks make money and gain popularity. And it's a part of the industry. It's not in and of itself bad. I think as long as you have the substance to back it up. So when I'm looking for someone to have a conversation with, learn from, go to their course, collaborate with, cross-brand with, I guess there's three things I think about, and I'll be quite upfront with you. I stole this straight up from Dave Tate, who owns and operates Elite FTS. What has that person done? Whether that's their degrees or their athletic career. Who have they trained or rehabbed or coached? Where have they done that? And the third thing would be, who are their mentors? Who have they studied under? I think it's those three things. So sort of a combination of both academic pursuits, personal pursuits, both personal athletic pursuits, and then also who have they submitted themselves under. Because I think you really are kind of, the average IQ of the 5 people you spend the most time with. And so who have you spent your time with, and who have you learned from, and who has challenged you to grow? So those are the things I look for.
On that note, how much do you feel you learned in school compared to how much you went out and found yourself?
Yeah, that's sort of a contentious issue.
Yeah.
There's a lot of opinion about that, and I think when I first came out of school, I was I think I was pretty dissatisfied with my academic progression in general. I felt like I didn't really learn what I thought I was going to learn. I thought PT school was going to give me a clear approach to musculoskeletal examination, to assessment, to diagnosis. And then I came out, I think, with more questions than I had answers. There wasn't an emphasis on movement as much as I thought there should have been. So I was pretty critical of the academic system. And then I taught at my alma mater, and I think that actually added to some of my objections to how academia is set up. However, I think in the last 2 years, mentoring students, I've had 5 PT students now, and I've had lots of undergraduates come through. I think that undergraduate and graduate school, they provide some really important qualities. And here's a kind of an example. So if you're out as a professional, you're 35 years old, and you're sitting in a course, and you're listening to someone give a talk, how quickly are you going to be susceptible to their dogma or to their approach? How quickly are you going to be able to question or challenge what they're saying? In other words, the more experience you have and the more foundation in science you have, the quicker you're going to be able to say, I don't agree with that. That's not science-based, or that's not evidence-based, or what I studied in biomechanics in undergrad doesn't coincide with what that person's saying, and I'm not sure I agree with that. And so I think you learn a lot more in academia than you probably really give yourself credit for. You finish with a bachelor's degree, you are an expert in what you studied for. And I think it gives you a great foundation for learning more and pursuing more learning, more education. So you can't go wrong with a degree, but I think the learning doesn't stop there, and perhaps that's where I think academia kind of gets a bad reputation, is that you meet someone who has the same qualifications, the same degrees, but has a very, very different product or a different success rate. And so to me, it's not so much about the degree or where you went to school, but maybe who you are as an individual. So how many times have you put yourself outside of your comfort zone and pursued learning experiences that are very challenging for you and are very uncomfortable? For example, my first year here with Gray, very small clinic, there was nowhere for me to hide. My first 2 PT jobs, they were larger practices with lots of clinicians and lots of patients. And it was very easy for me to kind of take the tough cases and send them off with somebody else and hide behind the easy ones that were having success. But to be in clinic with your mentor, and be challenged on a daily basis on the why behind what you're doing, how you're thinking, there was nowhere to hide. And it was very, very challenging and intimidating, but well worth it. So pursuing learning opportunities, both when you're in school, trying to connect the academic portion of what you're learning in the classroom with practical experiences, whether that's personally in the weight room, or pursuing opportunities to shadow coaches and trainers or therapists or doctors, physicians, whatever. And then when you get out, your learning doesn't stop with your degree. I hope each of you will become a lifelong learner in whatever it is you're passionate about.
On that note, could you tell us sort of who your 5 people are that you try to surround yourself with to be a product of those people, or maybe even just a couple of books or resources that you've read recently that have been really a big deal for you?
Sure. Well, Gray is one of my people, someone that I go to on a regular basis to present an idea or have a question. Dave Williams, strength coach at Liberty University, he's been a huge influence for me.
Have to throw the wife in there just in case she watches
Sure.
the video.
She's very important.
Yeah.
A colleague of mine here in Mountain River, Brian Duffy, he's a good clinician. He's down in Ocala, Florida, so I speak to him regularly.
4 is good.
Yeah,
4 is good.
yeah, that's probably my 4 that come to mind immediately. And I learn a lot from my students. You know, I really enjoy having students because I'm a better clinician when students are around. They challenge me, and I want to show them the best that I have to offer. And so that's a really great opportunity for me to stay on my game.
You talked about needing to seek opportunities that take you out of your comfort zone.
Mm-hmm.
That is not something that's second nature for a lot of people. Do you have any ideas on maybe how students can cultivate that if it's not in their nature, or is it just kind of a sink or swim type of thing? Obviously, having guidance or a mentor that pushes you out the window a little bit is important. It's a tough question, but if you have any thoughts on that.
Yeah, I'm really fascinated by the types of people that pursue different professions, that pursue different industries. And I think there's some insights. First off, I think if when you're looking at a profession, I think it's more important that you know yourself, that you need to understand what your own strengths and weaknesses are. So even those those personality tests that you may not think are all that important, they really are, because the more insights you have about yourself, like for example, this was somewhat of an epiphany for me recently. I'm an extrovert. I talk quite a bit, and I like to be around people. I get my energy from other people. So when students and people are around me, it doesn't matter what the setting is, I get energy and life out of that. I get excited, I get motivated, and I'm inspired because I like being around folks who want to learn and are passionate. But when I'm by myself, because I'm an extrovert, I tend to get more pessimistic and kind of negative about that, and even almost maybe kind of somewhat depressed about where I am or what I'm doing. So having that insight, that has encouraged me to welcome lots of students. I love having students because I know that I'm a better clinician in that way. So know yourself. I think that's the first thing. My analysis of our industry is that extroverts, people who can make other folks feel welcome and comfortable, they are the most successful. Mm-hmm. And so I think fundamentally, whether you're in medicine or you're in fitness and wellness, your clients need to like you. And that might seem like cheesy or sort of a well duh kind of a moment, but they have to like you at some level. Now I would like to back up my likableness with results and science and a service that they see value in, because I don't want to just be a likable guy. I want to have relationship and I want to have results. That's part of my personal statement, my personal why statement. But you have to like people, and if you don't have strong interpersonal skills or high levels of emotional intelligence, and you don't connect well with others quickly, then you probably need to find a different avenue for your passion. You need to find a different industry. And so, maybe research is for you, or there's, or writing or something else. But in our profession, where it's service-based, and you're around people all day, you have to be comfortable with that. And I think the more natural that comes, the higher chance of success you're going to have.
You guys take interns here at Mountain River?
Sure.
Do you guys screen for them? Can you tell me about what it's like to be an intern here, to apply for an internship? Some of my students will be looking for internships.
Sure. So. Well, I think that's a great example. So when I taught at Liberty, and when I was a student at Liberty, I felt like the internship was one of, if not the most important aspect of the degree. Your future potential employers don't care as much about your GPA or where you graduated from or what courses you've taken, but they care a lot about what are your experiences and where have you interned, because that's your network. That's how you connect in your industry. So think big and try and find the biggest, best, closest internship to what you want to do as possible. All right. So for interns here, it basically takes a recommendation from someone that I guess I know. There's at least a phone interview. I'm going to look over your resume. We're going to have a conversation or two about what you want to do, where you want to go, what your background is. It is mandatory that you have a strength and conditioning or fitness background. I also required that students are familiar with functional movement systems and the movement screen and or the movement assessment, and that you have a passion for helping and serving other people. And so I've out of my 5 PT students, I would say one of them was exceptionally bad, and it was my first one. The subsequent 4 have been really, really, really good. One of which was an MBA strength coach for 5 years, who decided to go back to PT school at UNC. And so because we're at Functional Movement Systems headquarters, we do get a chance to have some really awesome interns and applicants. But people who love what they do, they're passionate about their profession, usually in my experience love having students. So I think you think big. You know, the internet has made our industry and the world very small, so it's easy to connect with people who are doing what you want to do, and so I think you have to go for that. In fact, I would be concerned for students in this industry who aren't outgoing, who have difficulty, you know, cold calling or cold emailing people. I'd actually be concerned about, you know, if you're in the right industry or not, because I think that, again, that outgoing personality, personal training, at least as a business in most settings, is not about how good of a personal trainer you are or how well you describe the sliding filament theory, but it's actually how good of a salesman are you. Can you sell yourself? Can you sell what you're providing? And that was a huge delineation for me. That was a hard lesson for me to learn out of undergrad. Was it didn't matter how many courses I took or how high my GPA was or how intelligent I thought I was, but I needed to be liked by my clients. I needed to be confident enough and willing to reach out to them and pursue them as clients, share with them and demonstrate my value.
Is it frustrating for you to see clients led into either training or therapy situations where they've kind of been brought in just by the personality and then they're not receiving the care that they deserve? And then maybe how do you identify when that's happening? What's a good therapist, what's not? I know we talked about a few things earlier.
Yeah, I think, well, certainly, I mean, I think that's frustrating. I think, you know, Professor Saglambini and I are trying to elevate the level of professionalism in this industry. And so with professionalism comes an appreciation for what you do and what you're good at and what you don't do and what you're not good at. And so referring people elsewhere, I think is one of the best signs of a professional. You know, as a physical therapist, I had an evaluation yesterday of a fellow who came all the way from Bedford. It's an hour and 15-minute drive one way. He had seen a chiropractor, a physical therapist, and a primary care doctor in Alta Vista. He had seen an orthopedist in Lynchburg. He had seen at least 4 people. And he had had back pain for about 6 months, and he still wasn't any better. In fact, even on his examinations, the examination alone increased his symptoms. What I found when I took time with him was that his back pain, I think, was really coming from his left hip, where he had limited internal rotation and a joint problem. So I referred him to another orthopedist in Lynchburg to get evaluated and get an x-ray of his hip, because I think he has arthritis and he might need a total hip replacement. So that's me saying, hey, look, this is what I think is going on. I don't provide that. I don't do that. But I know a guy who does. He's within my network. So I think knowing what you do and doing that well, and then being comfortable and professional and referring out. So that certainly happens. I think there's a lot of people who are likable but don't produce results. And so maybe that's the component. You get someone in the door and you connect with them and you build a rapport, a relationship. They like you, they like their experience, but are they getting results? So in our industry, like I think just about across the board, success equals results in relationships. It's easy for folks in our industry to develop relationships. That's generally what the type of person that I think is successful, extroverted, and outgoing. But do you combine that with the objective results? So in physical therapy, it's about measuring a lot of things, both with that goniometer. We use a handheld dynamometer here. We use dual inclinometry. We also have bioelectrical impedance analysis where we do body composition segmentally. So measuring things, I think is important because it shows objectively your worth. It's not personal. It's not about me versus the chiropractor or the other physical therapist or whoever. It's I measured that fellow's hip internal rotation. He had 15 degrees on the left. He had 45 on the right. You know, it's not personal. It's not about arguing with anybody. Those are the facts. And most patients really respond well to the facts. Here's what I've found. Here's what I think is going on. Here's what I think you should do.
Is there anything else you want to add? I want to kind of keep it around a half hour so I can show them the footage we took in the clinic, because I think that's important. But
Sure.
Any last words or?
Follow your passion.
Come out here to the clinic.
Yeah, you're welcome to come visit. Sure.
Is there a place they can find you online, or any place where you write? Or I know you had a blog for a while.
Yeah,
or...
nope, stopped all that.
Okay,
So,
just doing stuff.
Yeah, my email is donreagan@gmail.com. My Twitter handle is donreagan. So you're welcome to follow me on social media. I post a lot on there, photos and videos of clients doing stuff.
And if you're broken, one of the best ways to learn about physical therapy is to be on the patient side, right?
Yeah,
so
sure.
if you ever have any needs, coming out here and seek treatment for yourself, or even if they're not looking to intern you, just welcome people to come out for a day at a time.
Sure,
and
shadow.
Yeah.
Certainly.
All right. Well, thanks, Don. Appreciate it.
You're welcome.
Bye.